Pleased to say that we have formally passed the Omicron peak here in the city of Chicago. And I'm going to be showing you first and foremost the data behind that. However, we are a long way from being out of the woods, and it's really important over these next few weeks and months that we continue to work hard on getting folks vaccinated, getting folks tested, continuing to wear masks, because there's a long way to come down. However, I'm really pleased to have seen this turnaround. So first of all, on the 4 major metrics that we follow, cases, we are formally calling as decreasing. We're averaging now just under 3,000 new cases a day. Test positivity also formally decreasing. We're at 12.6%. Our hospital beds, in terms of the number of people in the hospital with COVID, is just under 1,500 across Chicago hospitals, also just gently decreasing. And then our ICU capacity has actually stayed in that high transmission or high risk category. We're currently averaging just over 300 people in the ICU with COVID. So let's talk through the timeline and the data for this. So the first indicator typically that we see progress on is actually emergency department diagnoses. So we follow along on our dashboard people who are diagnosed with COVID in emergency departments. And not just here, but across the country, it's been seen to be one of the leading indicators. And our COVID diagnoses actually peaked December 7 here in Chicago at 671 people being diagnosed in the emergency department that day. There's always a little bit of variability, particularly around the holidays, where people may be going to the emergency department where they're unable to get care anyway, in other settings. But you see that sort of December 27, December 30, right in that range, remained high, and then we've had this very nice decline. We're currently seeing 132 Chicagoans being diagnosed newly with COVID across the city. That is still high. Numbers remain very high, but much better. So that was our first sign of real progress. Next, our test positivity. That actually peaked January 1 and has been declining since, though again, numbers remain very high. Peak positivity in the end was January 1st at 19.6%. And sometimes, when we're reporting out on the day of, there sometimes will be some delayed reporting, especially of negative tests. And so you may recall along the way, we sometimes were over 21, 22, 23% in the day of. But with all of the reporting in, January 1st turned out to be the peak at right around 20%. You can see that very nice drop off there and the current positivity of 12.6%. So we're confident, seeing that big decrease both in cases and then in positivity, that this is not just an artifact of testing. This is in fact a true peak. And if we look at that case number, our COVID cases in Chicago peaked January 4 with a daily total of 8,553 cases that day. So much higher than we had seen in any previous peak. And we are down, our 7-day case average now is averaging a little under 3,000 a day. Still very high, risk remains high, but heading in the right direction. And then if we look at the more severe outcomes, which we know tend to lag by usually a week and a half or 2 weeks, we've also started to see real progress there. And this is the one I was most concerned about and still remain concerned about. So COVID hospitalizations, meaning new hospitalizations of Chicagoans with COVID each day, have begun to plateau. You can see on that graph there. Our current daily average is just under 200 hospitalizations. So still almost 200 Chicagoans every single day getting admitted to the hospital with COVID. Our peak there on the 4th was 246, but you can see the average has been relatively flat. And across the system in Chicago today, we have 18% of our non-ICU beds available and 11% of our ICU beds available. Where we look at the census, which is not new admissions, but how many people remain in Chicago hospitals, that has also just started to plateau. It does remain higher, though, than in any previous month of the pandemic. Our hospitals are still stretched, make no doubt about that. And the most important thing is getting vaccinated, because that is the key thing for helping stay out of the hospital. Our ICU, similarly, you can see it's just starting to plateau there. We're calling it stable, not quite declining. We'll be watching this closely over the next few weeks, but I want to emphasize we probably will continue to see hundreds of Chicagoans being admitted to the hospital. So the threat is in no way over, but the news is good in terms of the direction that it's turning. So we're currently averaging around 300. Similarly, Omicron is almost everything we are seeing now in Chicago and across the Midwest. This week, you can see 99.3% is the estimate of all of the COVID cases are the Omicron variant, and just 0.7% are Delta, and nothing else is showing up at this point, nothing even reaching 0.1%. You can see how quickly, in purple here, the Omicron replaced the orange, Delta. And so if you go back to just the very beginning of December, when we detected the first Omicron case here in Chicago, we saw it just over the matter of about 5 weeks get to a point where more than 95% of the cases that we were seeing were Omicron. That also is consistent with what we've seen in South Africa and in other countries. But it is good news that Omicron is now at a point where it's almost everything that we're seeing. So what has been different with Omicron overall? These are Chicago numbers, but on different scales. So cases on the left here start at 1,000, 2,000, 3,000. Hospitalizations are in the 100, 150, 200, and deaths are in the 20, 40, 60. But when you look at this overall, what you see is that this is the whole pandemic. Compared to prior surges, cases dramatically higher than anything we had seen previously. But many of these cases have been mild. Many of these cases have been breakthrough, people who were previously vaccinated and had a case. Many of these cases have been reinfections in people who previously had COVID. So the case numbers breaking all records, and that is true across the country. Hospitalizations in comparison, you can see we have also had more people hospitalized with COVID in this surge than we have had in any prior surge. But in terms of the comparison, you see that's more similar to what we had seen in the first spike, for example. And then finally, deaths on the right, deaths I do expect will continue to rise for some time, but you can see that deaths in comparison to what we were seeing at the beginning are much lower. So I've said this every single week, but the data keeps bearing it out. Unvaccinated Chicagoans are so much more likely to be hospitalized, 5 times more likely to be hospitalized with COVID just over these last few weeks than unvaccinated Chicagoans. And then the red shows the unvaccinated Chicagoans, the light blue shows the unvaccinated Chicagoans, and then in dark blue, that's people who have also had their booster dose. It also provides an added protection. And then when we look at deaths, unvaccinated residents even more likely to die from COVID-19 than their vaccinated counterparts. Again, red here is unvaccinated, the light blue is fully vaccinated, and then the dark blue is the boosted. So 8 times more likely to die with COVID-19 if you're a Chicago resident and unvaccinated versus if you're vaccinated and get COVID. So if you've been waiting, now absolutely is the time, because these next few weeks and months, the risk does remain high as you are out and about, and we'll talk about the steps we need people to take. But I did just want to highlight that more than 99.9% of the people who have been vaccinated have not died from COVID-19 here in Chicago, and more than 99.8% of people who have been vaccinated have not been hospitalized with COVID. So the vaccines continue to protect very, very well, and I worry the most about people who still have not done that. I know there's always a lot of interest in what's happening with the kids, so just highlighting that our COVID-19 hospitalizations do remain low overall among children 0 to 17. That's that dark blue line at the bottom. You can see essentially flat, where in contrast, in the light gray at the top are people over 80. If you know somebody who is older in Chicago, especially if they're still not vaccinated, but even if they are, the risk is definitely higher there. And the child COVID hospitalizations have overwhelmingly been seen in unvaccinated kids. Here too is our hospitalization rates among children for COVID. So you can see we did see a peak, right in that last week of December, very beginning of January, and then now the hospitalization rates for kids are coming down as well. The solid lines in this graph are among those who are unvaccinated. And so you see that green line are 0 to 4-year-olds who have not had the opportunity to be vaccinated, as well as 12 to 17-year-olds who are unvaccinated. Whereas down at the bottom are where kids have been vaccinated, and then the 5 to 11-year-olds we have not seen a lot of hospital admissions overall, but that is improving as well. And just to kind of put a more specific point on this, there's been a lot of attention and focus certainly on children, and we keep that focus. The decrease that we are seeing seeing in all of these indicators is across all age groups, all race ethnicities, and all parts of Chicago. But I do want to highlight, this is, for example, Chicago children between the ages of 5 and 11 that have been hospitalized with COVID throughout the whole pandemic. So you can see, first of all, red are 5 to 11-year-olds who are unvaccinated, and we've had 2 examples in total of vaccinated 5 to 11-year-olds hospitalized. But you see that generally the increase that we've seen in hospitalizations for 5 to 11-year-olds is similar to what we saw last winter. So let's put this in the context of the whole country. The entire country remains under the City of Chicago's travel advisory for the 3rd week in a row. And nobody is even close to coming off it because the entire country is in this Omicron surge. Risk is high. As a reminder, if you are unvaccinated, we advise against travel. You need to be testing and quarantining upon return if you decide to, but the entire country is surging. Where we look at the details of this, we are seeing in the darker purple, which is much of the country, where the rates remain highest. And just to point out, nationally, we're averaging 238 cases per 100,000 per day. What's our goal? 15. Illinois currently averaging 233, a little bit under the national average and heading in the right direction. What's our goal? 15. Chicago currently 162 daily per 100,000. What's our goal? 15. So I do not want to imply that the good news of seeing this surge start to subside suggests in any way that the risk is low, that we aren't going to continue to see a lot of COVID cases. We are, as we continue to come out of this surge. We're seeing similar patterns around the country. I've been on calls every day, really, with counterparts in other cities and other parts of the country. So here's what New York City's data looks like, just like Chicago, past the peak, but still very high. And these patterns that we've been seeing here are consistent across other settings. Similarly, internationally, here's the UK. You know, I've been talking about following what's happening in the United Kingdom. And you see on the left are the cases, very similar to what our pattern is looking like here. A really steep decline in decreases, and then just starting to see on the right a plateauing among patients who are hospitalized. So this is behaving here just as it is behaving in other similar places. And then we are seeing signs of plateaus of COVID-19 in some of the hardest hit areas. These are some of the states that right now have the highest COVID cases. This is cases, hospitalizations, and deaths. The country overall perhaps just starting to plateau, but that is not at all ready to be called yet. And I do want to point out Wisconsin right there has seen no signs of plateauing and has one of the very highest case counts in the country right now, very much on the way up. And then regionally, while Illinois case rates are on the decline, our surrounding states are generally continuing to rise. Minnesota, Indiana, Ohio, Wisconsin, all with higher COVID rates right now than Illinois, and largely on the way up, with Wisconsin really standing out as having being in a major surge. So again, some excellent news here in Chicago, but we are the regional healthcare center for the region. We know people travel. Please continue to be careful because the Midwest is very much still surging. Vaccination rates are increasing. We're up to 79% of eligible Chicagoans over 5 that have got at least a first dose, which has been really good to see. If you look on our dashboard, you'll see that Black and Latinx Chicagoans have been leading the way in terms of the most new vaccinations that we've been seeing, which is excellent news because that's where we have the most room to catch up. An adult Latinx Chicagoan is now as likely as a white Chicagoan to be vaccinated, which is a really important milestone that we've been wanting to reach. We're still working on Black African-American Chicagoans. We're under 60% still for Black Chicagoans that have had a first dose, and we're just over 50% that are fully vaccinated. So really continuing to work with partners there, but if you know anybody who is still not vaccinated, especially younger folks, now is the time. And when we look at kids, and we'll hear from CPS in a minute, we're doing well here with vaccination for children. We're seeing good increases. We're up to 42% of those 5 to 11-year-olds with a first dose, and we're actually at 3/4, 75% of 12 to 17-year-olds have had a first dose, and that is well above the national average. Just 27% nationally of 5 to 11-year-olds, and just 65% of 12 to 17-year-olds. But we're not done. It's the most important thing for everybody in terms of keeping schools, safe as they possibly can be in terms of decreasing the risk for severe outcomes. Although those risks are lower among children, they are not zero. We know vaccination decreases not just the risk of hospitalization, but decreases the risk of MIS-C, which is that inflammatory disease that can follow, and really encourage you, even if your child does not have underlying conditions, to please get vaccinated. We do have plenty of vaccine opportunities across the city. I want to just remind you that we have extended our weekend Saturday and Sunday clinics through the end of February with city colleges. So this Saturday will be at Daly and Sunday will be at Wright. We have pediatric vaccines, adult vaccines, booster vaccines. These are only about 40% filled up right now, so go ahead and sign up in advance. We do take walk-ins, but we prefer appointments. When should you get your COVID-19 booster? Now. Anyone who is over 12 should be getting boosted now. 5 months after your initial Pfizer or Moderna series, or 2 months after your initial J&J vaccinations. We're up to about 707,000 Chicagoans who have gotten a booster. And we're making progress. We are, again, ahead of the national average there. About 45% of our folks over 18 have had that booster. Only about 65% of those over 65. Especially if you're older with an underlying condition, please don't hesitate. But even if you're not, get the booster. It helps. Right now, in this, even though we're starting to come down the other side, very much in this Omicron surge, it's the #1 thing. More important than masking, more important than testing. Getting vaccinated is the most important thing that you can do to protect yourself, your family, and get us through this. So which mask is best? I've been answering questions about this all week. The CDC formally says to protect yourself and others, you should wear the most protective mask you can that fits well and that you will wear consistently. So that means, for example, we successfully distributed more than 1.5 million KN95 masks to Chicago residents over the last week or so through all of the aldermanic offices, the community-based organizations, about 100 of them. These are really meant especially for people who have difficulty accessing, have challenges paying for masks, etc. These masks are reusable. I've been answering questions about Facebook all week. But the most important thing is that you've got a mask on, that it fits well. We've been encouraging people also, if you're wearing, people have gotten, they like their glittery, they like being able to have a mask that tells a story. Right now during Omicron, I would recommend, if you've got one of the surgical masks, those blue paper ones, wear that and put your glittery or billboard mask right over top of it. If you are wearing a KN95 mask, please do not wear another mask underneath it. It is important that KN95 masks or N95 masks fit tight to your face. A mask is not better if it does not fit your face well. A mask is not better if it is uncomfortable and you are taking it on and off. The most important thing is that everybody is wearing a mask in an indoor setting, and then you go up from there, and you can reuse them. Big news that the federal administration is beginning distribution of free at-home rapid COVID-19 tests. You can order a test online at covidtest.gov. I'm very pleased that this is being centralized. You know what a struggle it's been to get rapid tests. And so I encourage folks, you get 4 tests for each residential address. They'll be shipping them within 7 to 12 days. There are additional programs for harder hit communities, places where internet access may be more of a challenge. And finally, a positive test is a positive test. We've been saying this week after week, but I wanted to put a little bit of a more specific message on this. First of all, if you take a test, an at-home test, a test at school, a test in a pop-up, a test in a hospital, a test in a doctor's, an antigen, a PCR, a positive test is a positive test. We're seeing a lot of people, our epidemiologists behind the scenes, take all the positive tests in and then they go and deduplicate. So if somebody has gone and had 6 or 7 positive tests within a few days, we don't count that as 6 or 7 cases. But we are seeing that. We are seeing people going and repeatedly getting tests. Please don't do that. A positive test is a positive test. Stay home, isolate for 5 days. If you're feeling better, you can come out for the days 6 through 10 from your home, but you got to be careful with masks. But also, if you test positive and you have an underlying condition that puts you at a higher risk for being hospitalized, any underlying condition, or if you're older, please, if you get a positive test, call your doctor. Talk to your healthcare provider. We want you to call right away when the test is positive, even if you're feeling okay, because Antivirals, medications are increasingly available. And for those who don't know what these newer antivirals are, there's a number of different flavors and versions of them. But if somebody gets COVID-19, whether that's a breakthrough infection or a new infection, and they are at high risk for getting hospitalized, there are IV medications and now starting to be some oral medications that you can take that significantly drop your risk of being hospitalized. But they have to be taken in the first few days of infection, because the way they work is they stop the virus from copying so much in your body. So if you have underlying conditions, you get a positive test, reach out to your doctor that same day, because depending on your underlying conditions, you may want to be able to get some of those treatments. All of those treatments, you must see a doctor. You need a prescription. There's extra work that has to happen around it. But I want to make sure that people know about that option, because increasingly it is available. We've been working with providers to make sure that it's here and making sure that higher need areas have access to it. But if people don't know to call, it's too late to give you those sort of preventive medications a week later. So finally, as always, if you need a vaccine or a booster, if you've got a question about testing, if you've got a question about COVID, chai.gov/COVIDvax is your place to go, or 312-746-4835. We continue to sign people up for at-home vaccinations. That program is going beautifully, 7 days a week into the evening. 50% of the people who have been vaccinated through that program are Black Chicagoans, and given that that is the group we're most trying to reach, we've been doubling down on that access and continuing to make sure we work with community partners and trusted messengers. So if you know anybody who's not vaccinated, now's the time. Again, good news today in terms of being able to formally say we've passed that peak, but we are not out of the woods, and we need people to be very careful over these next few weeks. With that, I'll hand it to CEO Martinez.
Thank you, Dr. Arwady. Next slide, please. So what you're seeing here in front of you is for this last week, what our current cases were. And you can notice, and we expected this, that we saw a rise in cases, over 2,000 for students, over 1,300 for staff. Keep in mind that these cases really came in from the community. And so it was something we expected, and because we were doing testing, we would catch them, but you can see it's a significant rise from the cases that we saw prior to the break. The next slide. And this is what it's been in terms of quarantine. We now have over 13,000 students that are being quarantined, over 1,100 staff. Again, this was all expected, as we knew with Omicron that it was going to spread a lot faster. And you can see, again, this is one of the highest rates we've had of quarantine. I will tell you, and I'll talk more about testing that we just did yesterday, we're starting to get results already from the test yesterday, and already we're starting to see, because schools have been open, starting to see actually that we probably peaked in cases last week as well, just as the city has. Next slide. So I wanted to talk a little bit about our strategies. So, on the left, what you can see is our key strategies, really as we continue to prioritize the safety of our schools, safety for our staff and our students, is expanded testing consent as well as capacity, and I'll give you an update on what that's looking like. Increasing of the number of students that are vaccinated, and that I'm very cautiously optimistic what we're seeing there, as well as our continued investments in PPE and mitigation strategies, while we're starting to see a stabilization of cases, hospitalizations, and deaths. That is the winning formula for us. If we can, because we're playing the long game for those strategies on the left, and as cases start to stabilize, our schools will continue to be safer. Next slide, please. So first of all, let's talk about consent and capacity. So prior to the break, we had reached 40,000 consents with students. We have now doubled that number to 80,000. The vast majority of that increase has been unvaccinated students. So repeating that, the vast majority of those additional consents. So we've been very, very focused on targeting schools that had low consent rates as well as high unvaccinated students. So we've more than doubled that. In addition, just yesterday alone, we hit the capacity of 17,000 tests done in a day. Just last week, we had hit, on a 3-day period, the most tests that we've ever done. These are our weekly tests that we do at schools at 36,000. So that's about a 12,000 a day. We're now hitting the capacity that we can sustain a minimum of 10,000 tests per day. Remember, prior to the break, we were trying to reach 8,000. Remember, I talked a lot about having a goal of 40,000 for the week. That's what I wanted to reach. We've already exceeded that, and yesterday alone we hit 17,000. So, by the way, with that, we're not stopping there, because again, we're playing the long game here. We're augmenting the staff of our vendor, so we already have trained our nurses. We are also training other paraprofessionals that are right now doing various duties related to COVID in the schools. That's going to augment that as well. So again, you have more consents targeted at schools. That's going to help us reach our goal, which is based on the science, that we want at every single school a minimum of 10% of unvaccinated students being tested weekly, because that will give us the information we need to determine if those schools are at high risk. And so that, we're building that very fast. Next slide. And so again, this just shows you the consents. You can see the significant, increase that we saw just post the break. Now as of today, by the way, close to 83,000 tests. Next slide. And you can see again, we're seeing the increase in the actual tests being administered, with this last week being the highest we've ever done in a 3-day period. Remember, it was only 3 days that we had school, and that was over 36,000. Next slide. And keep in mind, we are testing at every school. We've been testing at every school even before the break. Once we got to that level, the goal then was to just continue to build capacity. And now we want to have a sustainable level of capacity, as well as we're targeting students that are unvaccinated with minimum thresholds at every single school. This is what you're seeing here is the positivity rate. Now keep in mind, we saw an upsurge of cases. It is not a coincidence that those cases came in as the schools were closed. Even with that, the positivity rate, when the city was close to 20%, our positivity rate was hit 5%. We have seen that pattern consistently, that whenever you look at our cases, as high as they are, we're always a fraction of the city. The other thing I just want to comment about the testing, keep in mind, as we're looking at 10, 12,000 tests per day, you put that for a week, the city in total testing, including our tests, they range between close to 30,000 up to the highest 50,000. That's including our tests. So keep in mind, that's our numbers as well. And so for us, it's just important to put that in context. So as we're building our testing, we're going to start exceeding the testing of the city potential that doesn't include us. And so again, we're playing the long game, but that's our goal, is to continue to make sure that we prioritize safety. Next slide. And so here's a thing that's getting me more, again, cautiously optimistic. We are seeing, improvements. Now, again, one of my frustrations, we hit over 50% of our secondary students, 12 and up, getting vaccinated. That's been slowly moving. I will say we are seeing more improvements on first shots, but we still continue to have a significant gap with the rest of the city. 5 to 11, we're seeing a lot more movement. And here again, we are doubling down. We'll show you in a little bit all the vaccination events that we're doing. We're also calling families. We're actually making sure that we're bringing in community partners, and want to make sure that we make that even easier for them. And so we're going to keep doubling down on that. If you go to the next slide. So this just gives us some numbers. So over 53% of our 12 and up are now vaccinated. We finally reached over the 50% mark, but it's still moving too slow. I love our student voice. I love our student activism. I love that energy. I wish we could, again, encourage more of our students to get vaccinated, especially at the secondary level. Where I am getting more excited is look at what's happening with our 5 to 11. We're now over almost a third of our students and now have gotten at least their first shot. Look at, when you look at fully vaccinated, we now are over 111,000 students. Almost half of our students are now reaching the first dose. So again, keep in mind the strategies. As cases are stabilizing, we're expanding consents, we're expanding testing. At the same time, we're seeing more students get vaccinated. That is just the formula that we want. Go to the next slide. This is an example, for example, just for the week coming up, all the vaccination events we're doing. And, and again, I can't continue, I can't stop complimenting Dr. Arwady and her leadership. I mean, CDPH is doing home vaccinations. We have vaccinations across the city. These are mobile events. We can mobilize and go to any school. Ladies and gentlemen, I have never, since I've been here at the end of September, have never run out of vaccine supply. I've never had a time when we had to turn away a family because we ran out of vaccines. Have never had that issue. We've had other challenges, and we've learned a lot of hard lessons. We have never had that issue. And so again, as Dr. Arwady said, again, the anxiety is real. Let's really make sure that we acknowledge it. The anxiety is real. The fear is real. There's a lot of tension. But at the end of the day, we have a solution in front of us. And we just have to continue to encourage to take advantage of that solution. Everything else helps to reduce the risk. Nothing solves it. Nothing solves it, and nothing solves it as close to 100% as vaccinations. Go to the next slide. And then finally, in this last slide, our continued investments. You can go on our website, go classroom by classroom, and assess the ventilation of any of our classrooms, any school. If there's ever a school that is in the red, we don't allow classes to take place in that classroom. They have to be in the green. So that's something that we monitor on a daily basis. In addition, we have over 1.2 million K95 masks that are being distributed by the end of this month, 4 million that are being also purchased and will be distributed in the month of February. Again, we're playing the long game on this. So for us, again, the goal is to continue to be, and I continue to be humbled by this pandemic. I was feeling more comfortable with Delta right before the break, and then this hit us, and we've had a pivot, and you're seeing how we're pivoting. Go to the next slide. I think that's the last slide. Thank you.
Muy buenas tardes. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y hoy les tenemos actualizaciones. Tenemos buenas noticias. Los casos de COVID-19 continúan disminuyendo. Estamos en el pico de la pandemia o de este repunte. Solicitamos que estemos cautelosamente optimistas de seguir pendiente, de seguir las vacunas, de seguir cuidándonos, poniendo nuestras mascarillas, implementando las técnicas y estrategias de mitigación que ya conocemos. Los casos de COVID-19 continúan disminuyendo. Hoy el promedio de casos es 2.903 de 5.399 que vimos la semana pasada. Eso es una disminución significativa de 46%, casi un 50%. Lo mismo con las hospitalizaciones, 196 al día, 200 hospitalizaciones diarias. Es todavía muchas hospitalizaciones, pero ha habido una disminución sutil y las muertes bajaron a 14 de 21, 36% disminución de la semana pasada. Estos son números promedios. Recuerden, es un anuncio positivo, pero tenemos que seguir adelante porque no estamos fuera de la pandemia. Los casos todavía siguen siendo muy altos. La positividad sigue descendiendo y eso favorece aún más lo que ya le estamos constatando. Hoy estamos a 12.6% de 17.2% de la semana pasada. Todo es alentador. Seguimos vigilantes, seguimos cautelosos. En la capacidad hospitalaria tenemos 1.354 camas disponibles, eso es un 18% de capacidad. Y en el intensivo tenemos 311 camas disponibles, eso es 11% de capacidad. Los números son estables. El diario más alto, de casos más altos registrados en Chicago fue el primero, enero 4, con 8.557 casos. Eso es un número récord nunca antes visto. Esta baja la vemos también a nivel nacional en casos de COVID-19. Hoy tenemos un promedio de 66 millones de casos acumulados en los Estados Unidos y lamentablemente más de 3/4 millón muertes acumuladas. En los Estados Unidos, 850.750 muertes acumuladas. Cada muerte con la existencia de la vacuna es algo trágico y merece ser mencionado. Omicron es responsable de 99.3% de nuestros casos. Cuando hablamos de la vacunación, estamos también optimistas, porque hemos visto un alza en la vacunación, pero instamos a que se sigan vacunando y sigan tomando los refuerzos, ya que vemos que nuestras estadísticas han demostrado que la protección es muy alta en personas vacunadas y al día con sus vacunas y sus refuerzos. 99.83% no han sido hospitalizados cuando reciben sus vacunas y sus refuerzos. Y 99.9% no han muerto por el COVID-19 cuando se vacunan y reciben sus refuerzos. La vacuna sigue siendo altamente protectora contra la infección, aunque la variante de Omicron muestra la capacidad de evadir la inmunidad. Las tasas de caso entre adultos de mediana edad no vacunados se han disparado durante el aumento de Omicron. Es importante reconocer la protección de nuestras vacunas. Las personas vacunadas tienen mucho menos probabilidad de ser hospitalizadas y una dosis adicional a un refuerzo claramente brinda protección adicional. Las tasas de hospitalización en niños han disminuido por el fuerte aumento que vimos en el 2021 cuando lo comparamos con el aumento de la vacunación. Desafortunadamente, la mayoría de los hospitalizados siguen siendo los no vacunados. Los residentes de Chicago no vacunados tienen muchas más probabilidades de morir por el COVID-19 que sus contrapartes vacunadas. Las hospitalizaciones por COVID-19 siguen siendo las más bajas en niños de 0 a 17 años. Las hospitalizaciones infantiles por COVID han sido en niños no vacunados. Las tasas de vacunación siguen aumentando en Chicago. Ahora contamos con 78% de los habitantes de 5 años en adelante que han recibido por lo menos una dosis de la vacuna. En Chicago, las tasas de vacunación por edad continúan aumentando y por encima del promedio nacional en niños y adolescentes. Cuando estamos hablando de los refuerzos, la población de los Estados Unidos tiene mayores de 18 años 40.6% de vacunación y Chicago está en 44.8%. En personas de 50 años en adelante, que sabemos que aumentan los riesgos de hospitalizaciones y muerte, la nacional está en 52.3%, Chicago está en 55.9%. Y mayores de 65 años, la tasa nacional está en 61.3%, Chicago tiene 64.5%. El consumo de los refuerzos es más bajo en Chicago en menores de 12 años, que deben recibir una dosis de refuerzo si están elegibles de 12 años en adelante, y lo vemos con mayor frecuencia, la tasa más baja en la población latina. Por favor, latinos, recordemos, la protección de nuestra familia es número uno. Nuestra salud es la prioridad. El mayor número de aumento de los refuerzos de 12 a 17 años está en línea con la elegibilidad ampliada que acaba de aprobar Pfizer y ahora también los intervalos han cambiado con Pfizer y Moderna. Seguimos recomendando las preventivas de salud, como usar las mascarillas. La CDC recomienda que si puede y tiene acceso, por favor considere la KN95, que filtra 95% del particulado. Pero lo más importante y el lenguaje más fuerte es que la mejor mascarilla es la que toleres y que te brinde la consistencia, y que la puedes usar en forma consistencia. Estamos ampliando el horario para nuestras clínicas de vacunación de familia a nuestros colegios Richard Daley, Wilbur Wright, Kennedy King, Olive Harvey, Truman College y Malcolm X. Lo vamos a tener abierto durante los fines de semana para aumentar la disponibilidad y el acceso a las vacunas de 9 de la mañana a 2 de la tarde. Acuérdense, las vacunas siguen siendo gratis. Tenemos el programa Protege a Chicago al Hogar, donde vamos a su casa y vacunamos hasta 10 personas por vez y damos incentivo de hasta $50 por vacuna. Recuerden, también pueden recibir los refuerzos ahora en sus casas. Y si tiene algún tipo de duda, por favor llame al 312-746-4835. La ciudad acaba de repartir 1.5 millones de mascarillas KN95 a las comunidades altamente devastadas y que tienen los menos recursos. Así que continuamos con cautela. Cuídese, Chicago. Y le devuelvo el micrófono a la doctora Arwady. I give back the mic to Dr. Arwady.
Please announce your names and your outlet, and who would you like to speak to?
These are mainly questions for Mr. Martinez. One thing I wanted to ask is whether you know if those school-based events, COVID-19 vaccination events, are getting a lot of turnout, and who is running those, and how are those going? The ones that are at the school during the school day.
Yeah, so in terms of, we are seeing more activity. We are seeing, in fact, the last numbers I saw, we were seeing easily double digits, and even in some cases close to 40% more activity on the actual events. Keep in mind, we have multiple healthcare partners, and so we have including 24 school-based clinics. So we work with our partners to coordinate all these events And then we're inviting more partners to come in as well. But we had over 500 mobile events that we've done since the school year started. But we are seeing more activity, which I think is starting to show up in our numbers, which makes me cautiously optimistic. And we're seeing it particularly with 5 to 11-year-olds.
I'm wondering, most of those are events from 10 to 1 during the day. Do you have any input on those times? Because those times seem particularly difficult for working parents to coordinate.
That's a good question. And so let me follow up with my team, because one of the things that we really want to make sure we double down is how do we make sure we make it accessible for families? And so let me get back to you on that.
And then, did you want to add something on that?
Oh, I was just going to add, one of the reasons why we have the family clinics on Saturdays and Sundays is to complement not just at CPS, but at schools across the city that tend to be more Monday through Friday focused. But we have certainly been looking at opportunities. And we do also encourage CPS families and everybody else to sign up for at-home vaccination as well.
This is sort of a bigger picture question that I wanted to ask, and that's that, prior to the pandemic, neither the school district nor CDPH did that much direct service. And now there's a lot of direct service, between testing, when it comes to public health, between testing and vaccination. And I'm just wondering what it's been like to try to ramp up, especially with the school district, to be like a public health organization that provides testing to 80,000 kids on a regular basis.
Yeah, I think it's a really interesting question. I'll start and you can chime in. I think people often don't realize that a lot of the direct service work that the health department does. For example, in CPS, the health department operates the dental program to make sure kids are getting their teeth checked and some of the fluoride treatments, et cetera. We also run the vision program so that kids are getting their eyes checked, they're getting free glasses. There's STI programs. Like, there actually are a number of programs. We directly operate mental health clinics. We directly operate WIC, which is the Women, Infant, and Children Nutritional Program. We directly operate sexually transmitted infection programs. We see all the patients who have tuberculosis in the city. So there actually is quite a lot of direct services. It just doesn't tend to get, I think, as much attention necessarily. However, this has been obviously a huge ramp up, and we've really tried to be really mindful at the health department of making sure that where we are putting sort of the city resources, they are going to where the need is greatest. So, for example, we operate we have bricks and mortar immunization clinics that operate all year round, all the time anyway. Of course, they see, and they're located in places where we have need. But we've really tried to kind of use data and input to say, where do we need to plug in the most? Where do we need to fund around this? And I think it's honestly, for me, the larger question is less about sort of CDPH and more about what does this say about our healthcare system overall, because our healthcare system overall tends to be very privatized and individualized. And I think we have seen in COVID that there are limits to that everybody expects that the government should provide the vaccine for free, or, this decision to sort of bring the testing sort of into government. That is not a traditional approach. It is a traditional public health approach, but it's not the way healthcare has been delivered here. And I think it's been good for the country to sort of see that there are reasons to think about access for healthcare, especially some of these preventive things, in a way that is not tied to employment or insurance status. But it is definitely something we've tried to struggle. We've struggled with how much of a role you play, and wanting to make sure that we are also hiring in communities and really making sure folks who are trusted messengers can kind of grow those resources. All trying to think about what this looks like, not just for COVID, but over the next 5 to 10 years.
Yeah, just very briefly, frankly, it's been a challenge. When I'll tell you, one of the biggest stressors that's on our principals and our team in general is we're having to do a lot more for our families. And really, I can't be, I'm just so grateful for the staff, from our nurses are now going to be doing a lot more, but we've had our health team, we've had our principals, our teachers, our counselors, all of our partners. And I think what's important for us to appreciate is the scale. I think that's the challenge. It's not that, we want partners. I would love to have, 10 providers of testing, 10 providers of everything. That's what we need at this scale. And the challenge has been really the scale. And so, I think, like I said, there's a lot of lessons learned. I am now more optimistic today of where we're at and where we're going. And like I said, this is the long game for us. And you know what I'm telling our team is we have to figure out how to manage to live with COVID. And so that's going to mean us doing more for our families, doing more for our staff. So be it. With that, you know, I'm going to ask the community to give us some grace because we're learning. We're not a health institution. Thank goodness I have a partner like Dr. Arwady because she is there with us every step of the way, consulting with us. But it's the scale that is the biggest challenge for us. And I think now you're starting to see, you know, we're really hitting a cross point now where hitting a level of sustainability that really starting to serve the scale. But, you know, we're the only district that I know of that's trying to do this. Other districts, large districts, they're either doing very minimal testing, like random, or they really have the entire community really providing it for them.
There's a one
Doctor-
that I had from another outlet.
We have enough left to take that one, you see?
Thank you.
This is from Chalkbeat. They wanted to know if the CDC and now that ISB updated their quarantine guidelines, does CPS have any plans to shorten its quarantine policy from 10 to 15 days?
You mean 10 to 5 days? So absolutely, that is going to be our plan. We are working with Dr. Arwady just to understand all the operational logistics because it isn't just as simple as shortening to 5 days. There's a lot of other requirements that happen for both students and staff. So we're in the process right now of identifying those operational logistics, putting a plan with our schools. By next week, I'll be able to give you a very clear timeline. But the short answer is absolutely. We're going to be adopting that. I want to make sure we do it right.
Dr. Arwady, as we hear this good news or some optimism moving forward, people are going to hear we've passed this peak. I think a question that will come to mind for so many of us is what's next, and are we seeing light at the end of the tunnel? Is there a specific metric we need to hit to remove restrictions and get back to whatever our new normal is going to be?
So a couple things on that. You heard me saying every time there was good news that cases are still high, that risk is still high, et cetera, and it's important that people are hearing that. I think we have a very long way to go to be down to a place where this is manageable, where we're, quote, living with COVID. And I do think we will be living with COVID for the long term. That's part of why I was highlighting, this is the risk and here's what we're aiming for. We're following the same metrics. I think increasingly the severe outcomes are the ones that will be followed the most closely, the hospitalizations and the deaths, given that there's more consistency there as the testing patterns have changed, et cetera. And I actually think we'll be monitoring this in very similar to the way we monitor flu, frankly. So for years and years and years, 100 years, CDPH has monitored influenza. We do not count every case of influenza, right? But we have ways of sampling. So we do count everybody who goes to the ICU with influenza. We count deaths with influenza. We look for pediatric cases, and then we take samples. So we understand, like that one that I was showing you of people who come in, what percentage, in an emergency department end up testing positive for COVID. We do that same thing for influenza. We take samples and we look for we don't call them variants, but the strains of flu behind the scene. And then there's other wastewater and other surveillance that we're working on building up. So I think people, sort of general public, you want to watch the exact same numbers you've been watching. We want to see all of those same, that's the reason we've sort of tried to be specific, those 4 metrics, people understand them well, I think, and we want to see them come down together. So I made a point of saying the cases and the positivity coming down together. One of the things we see in CPS, when the testing really goes up, you will see more cases get diagnosed by definition. But if you are seeing cases go up and positivity go down, it tells you it's also a function of testing, right? You are actually seeing a change in the population when those move together. So I'm hopeful that we'll be back under 10% and then continuing to make progress on positivity, and we've got to get well under it on cases, but especially those hospitalizations are the things that I think we'll be watching long term.
Okay, and just quickly on the masks, are you aware if all of the 1.5 million have been distributed? I know that was kind of on the aldermen and community partners to do that. And do you anticipate another large-scale mass distribution event like that anytime soon?
Yeah. So they have all gone out from the warehouse to the partners, and different partners and aldermen, have some different plans. A lot of them are already out the door. There are some that are still being distributed. Everybody's got their own plan around that, and we encourage that. This really, in terms of this 1.5 million KN95s, that really was designed from the beginning to be a one-time sort of push at this moment. I felt like in the middle of this Omicron surge, it was important to get these out. We've heard again, that the federal government is planning to release some more, it sounds like N95s, which will have their own complexities. There aren't child N95s, et cetera, but they are planning to release some more of those, perhaps through pharmacies. We'll be keeping an eye on that, but I don't have another 1.5 million, sitting ready to distribute, and the goal was get them out quickly. These are widely available. There are high quality, inexpensive masks that are widely available. I did buy mine on Amazon, and where people have resources, I encourage them to, to get some of these in the short term, but obviously we want to fill in the gaps, and we'll continue to do that. And as more comes in, certainly from the federal government, we would, of course, in the same way we do for everything else, distribute them in areas where it's most needed.
Hi, Ravi Bajwal with ABC7. First, one for you, Dr. Arwady, and then one for you, Mr. Martinez. Let's talk about tests and home tests. We're getting a lot of reports of people being confused by the results they're getting from home tests, taking home tests over and over again. You said a positive test is a positive test, and listen to that. So that's one interesting part. But how satisfied are you with the accuracy of these home tests? Are they, people who are getting positive results, are they reporting those to you? Do you have confidence in your numbers that they're accurate given whatever these home tests are saying? And generally speaking, as they come out from the federal government en masse through the mail and all the rest of it, what are your thoughts about this, and will testing become more accurate or less accurate going forward?
Okay, good. So first of all, the quote accuracy of these at-home tests is very, very good, especially actually when cases are very high. There's something that we call the positive predictive value, which is a combination of sort of how accurate a test is and how likely is it that a positive test will actually be positive. When cases are really high, chances are very good that a positive test is truly positive. It's different than newborn screening, for example, where we are screening for very rare diseases, and so a positive test might have a better chance of being negative. Here, a positive test, especially right now in the surge, is positive. I really, really like the at-home antigen tests. They're the ones I really turn to because you can get a result back right away. So you can act on it, right? So you can right away do your isolation for those 5 days. You can also, if you've got underlying conditions, get connected to some of those newer medications that I really want people to get connected to, because that's going to be part of our long-term plan here for controlling COVID. And they are, PCR tests are more sensitive, but they stay positive for a really long time, and they can confuse people because PCR tests are not picking up an amount of, they're just looking for the DNA. So you can have dead virus that is not transmissible. And so this is where we've really tried to help folks understand any positive is positive. Start isolating from there. You do not need a negative test to come out of your isolation at the end of that. And in fact, you should not try to take a PCR test because the PCR test can stay positive for weeks sometimes afterwards, but that same sample that would be positive on the PCR doesn't actually grow when you try to grow it in the lab. It's not transmissible, it doesn't spread. And so there's a lot of like PCR tests are the best. There's no one that's better or worse. They're better for different scenarios. I love the antigens because you get them right away and you can act on that. And I think increasingly they're going to be what we're using. To the point of whether they are all reported, they are not. The great majority are not reported. And that is true all over the country, but it's not a problem because, again, we don't have to count every case. This is where understanding the patterns overall between cases and positivity as well as severe outcomes. We also know generally across the country about half of the tests being taken these days are these at-home antigens. And so we're able to do some correction for that in terms of projections if we need to. But I don't want people thinking this at-home test is not good. I think it's great. It's the one I use. And if somebody is wanting to kind of reassure themselves that they're trying to test, they're in quarantine, they're in isolation, I would strongly recommend actually using the antigens over the PCRs.
All right, that's quite the summation. Okay, so Mr. Martinez, if we can just talk to you very quickly about your numbers. You did not mention, other than talking about the number of people on staff who've been vaccinated, you did not talk about the teacher shortage. Can you talk about a CPS teacher shortage? What's the percentage, and what are the remedies to address this situation?
Yeah, so a couple of facts. First of all, so this year we had one of the highest staffing rates ever when we started the school year. We had one of the lowest vacancy rates, and so that really strengthened us coming into the school year. We were starting to see, especially as cases were rising, higher absenteeism. So we were starting to hitting the low 80s right before the stoppage. Just as of yesterday, we hit 90%. And so that, along with having more than 50% of our subs that are active every day also being present. So that gives us a combined coverage of well over 95%. That's what we're trying to sustain. It doesn't mean that we won't have struggles at individual schools, but district-wide, we're not seeing big struggles. And when we have individual schools, we can mobilize staff to work with those schools. So that's what we're going to keep watching. We're watching that data every single day now. And so keep in mind, we started even right before we came back from break, we started enhancing sub rates, including the additional, which is $1,000 extra per month for substitutes that give us more coverage, especially on the hardest days, which is Mondays and Fridays. And so we're going to continue to do that. I've always said this. I think our substitutes, if anything that has come out of this pandemic, how valuable they are to school districts. And I think it's a good thing that overall we're going to value them even more.
Any chance you're going to raise that compensation because the pressure is on?
We'll continue to adjust. I mean, we've been doing that since the beginning of the year. Frankly, in this case, we're in the same boat as every other big employer, right? I mean, in order for us to get more coverage and more staffing, we have to compensate better, and I'm glad the substitutes are the beneficiaries of that.
Hi there, Sally Schulze from Fox 32. CEO Martinez, if I could ask you, you were talking about the increase in cases, which was not a surprise, but I just want to clarify. You said that it was not a coincidence that this happened when the kids were not in school. Are you suggesting that you had more students catch COVID because they were home, not in school during the work stoppage?
So the pattern we have seen consistently, and I saw this in my former district, in my former state, I've seen it here, every time we have an extended period, especially when you have something that's happening with a surge, we always see the largest number of cases right after as they're coming into school after a long period of break. And so it's not a surprise to me that we saw those surges immediately. I think this week will be interesting because remember the city peak last week. I think as we look at cases this week, I wouldn't be surprised if you're seeing a downward spiral of cases because schools are actually open. And frankly, I've always said this. Our schools are a reflection of the community. I can tell you I have a big family. We love gathering together. And when we're together, we let our guard down. You don't see many of us wearing masks. You don't see many of us because we're a family, right? And the challenge is with Omicron, frankly, we know how much more contagious it is. So it shouldn't be a surprise, but we'll be watching the data. We're watching it now very closely.
Can I just add to that quickly? We watch very closely among not just CPS but all the schools to see if we're seeing anything unexpected compared to the community, which we have not seen there or in other settings as well.
Dr. Arwady, Chris Ty with CBS 2. You talked about looking at the UK as a sample. Just today we saw their numbers are down about 30% over the last week. There's been a signal of a massive reduction in what the Prime Minister is going to be asking of people there. They're going to remove some requests for vaccination proof. They're going to remove the mask mandate. I'm wondering, as we hear this positive news today, what did you learn from the last, quote, return to normal? When we thought we came down last time and then we came back up. What have you learned as we try to reapproach normalcy again in Chicago? What did we learn from the last time that we can apply this time?
Yeah, sure. I think that's a really good question. So there's a couple of things I would say around this. Number one is that we have defined what is manageable, sort of, in terms of being able to live with COVID. The CDC has done this nationally. Our numbers here in Chicago match this. So there are these 4 levels, right? Level 1, level 2, level 3, level 4. And the whole country's in level 4 right now. But the last time we were down into sort of level 2 was last summer. And one thing I learned, and this was going out a little bit on a limb, was that when we are in good control, it is good to take advantage of that moment. And so that was actually the time, I don't know if you remember, but we went fairly aggressively in terms of being open. We did not sort of put additional restrictions in place. We moved ahead with Lollapalooza, like all of these other things, really saying now is a time, epidemiologically, I feel confident in doing that. And I think it is important, actually, that when epidemiologically we are in reasonable control here, that we can drop a lot of those restrictions. We are nowhere near doing that yet in Chicago, just to be extremely clear. We'll need to see us come, well down back to sort of the moderate to lower risk to do that. But we continue to, track those same metrics as we do that. And, I think the sort of what's next piece, Omicron surprised everybody because it had so many more variations. It was so much more contagious. And then it just presented differently, right, in terms of so many more breakthroughs. But then the vaccine is continuing to protect against hospitalization. So I think we will, not that we haven't been following those more severe outcomes, but I think increasingly that's what we'll be interested in. And not just, getting people vaccinated isn't much about keeping people out of the hospital, but making sure they have access to therapeutics is also about keeping them out of the hospital. Like, how do we make this something that does not need to disrupt our lives? I am certainly more optimistic now than I was, but we are going to have another variant. There's no question about it. It's just when and what that variant looks like. So
what the UK is doing is very premature in your estimation.
That is not a move that I would make based on what we have seen here at this point. But we are not keeping this forever. We are, and another reason for people to sort of really stick with us right now in terms of keeping those masks on, getting vaccinated, being careful, is to help get us down as quickly as we can so that we can relax some of that.
A question one of my colleagues had that I wanted to ask of you regarding vaccination proof. Should businesses in Chicago be questioning and in some cases confiscating fake cards when enforcing the vaccination order? We're hearing cases, people bringing in things that look a little questionable. Businesses feel it's within their right to pull them. Where does that actually stand? Yeah,
so there is actually information on our website where people are able to report that in. There's a big division that looks at this. Actually, a lot of it is federal, and they have done some crackdowns of some of these. I would not really encourage businesses to be confiscating per se, because I think then it becomes their responsibility at some level. But certainly if they are seeing something of concern, we would like them to report that. And there's information on the website for how to do that.
Aaron Gator's going to ask a question for Black Law.
Kelly Bauer for you, please. She asks, in light of recent reports in the Minnesota Attorney General's office lawsuits, does the city have concerns about testing results coming from Center for COVID Control, which has numerous sites in Chicago? She also asked, will the city do anything to review the test results coming from that company and its lab? I'm assuming you are aware of the reports today that they've...
Yeah, this is one of the investigations that, well, I think this was the state attorney generals have been looking into any concerns that come up around these testing sites, one in Illinois, but I think this one was in Minnesota, and this is one of the divisions that has branches sort of across the Midwest, is my understanding. So I've only just learned about this myself. So we'll be taking a look at do we have some of those located here, and is there further guidance around that? Overall, though, I just do want to reassure folks that we've not seen a big pattern of problems with invalid tests at pop-up testing sites, et cetera. But we certainly will investigate this one in some more detail. I've just learned about it myself.
Very good. I have a follow-up for her before my two questions. I know that Omicron's new and it's impossible, well, not impossible, but difficult to tell the future and that kind of thing. But I mean, once this surge ends, do we have any sense of what it's going to be like having Omicron out in the open in the spring and summer and that kind of thing? I mean, I've heard that it spreads like measles and that kind of stuff too, but I just thought the R naught and that kind of stuff. I mean, what's it going to be like, operating post-surge, with this virus out and about infecting people when it's, not spreading like wildfire or coming down off of wildfire? Can you say anything about that?
So I would say one of the things we're very interested in are what we call the serologic studies, which are, we look at the population level of how many people have antibodies to COVID. And that's where we get our estimates around, the hundreds of thousands of Chicagoans that have neither been vaccinated with COVID nor been infected with COVID. I am confident that with this wave, there are a lot of Chicagoans who now have at least some, quote, antibodies from COVID. Now, where we see really mild infections, that is sometimes not actually as it doesn't help you as much in the future, and this is in no way a replacement for being vaccinated, but we've got a lot of people now who are vaccinated and had a breakthrough infection afterwards. We knew heading into Omicron that people who had had COVID in the past and then got vaccinated had the best protection out there. I am most interested in if it goes the other way, if the people who are vaccinated and then have had a breakthrough infection, is their level of protection when we look at bone marrow similar to going the other direction? We're still learning about that, because if that is true, I would expect there to be many more people who would not have a lot to fear from sort of Omicron moving forward. That doesn't set aside a new variant that may come and other changes, et cetera, but I think everything to date, has suggests that sort of as we start to come down from this, the risk should continue to dissipate for people. It won't go away though. And again, I mean, I say it every 5 minutes, but being vaccinated is just what folks really need to do to have the most important protection against the severe illness.
Do you have any sense of timeline for those serologic studies when we'll have results from them?
Oh yeah, they happen. They happen sort of on a monthly basis. It's a national program, so they happen on a monthly basis, and we'll have updates. We'll be interested in what our January updates look like.
All right, mine too. Dr. Walensky with the CDC said last week in her update that said there were up 40% in the current death surge in the country right now. She said that those deaths were predominantly from Delta, not Omicron. There were 99 deaths reported yesterday, which is the worst 24-hour period ever. Do we have any sense of how many Chicagoans are going to die from this Omicron surge right now?
Yeah, quite a lot. I mean, we've been averaging. Right now on the dashboard, it's showing just an average of 14 per day over the last week, but it's probably a little bit higher than that, where there's been a little bit of delayed reporting on deaths because the numbers have been so high. I think probably it's closer up in the 18 to 20 per day, which is 100 per week, which is a lot. We do. Most of those are, I would say here, most of those are Omicron. We were a little earlier than some of the rest of the country, so that may not be true in places that are only just now peaking. But I worry because I continue to hear on social media people saying, oh, Omicron isn't dangerous, nobody dies from Omicron. There are lots of people right here in Chicago dying from Omicron, especially, like I said, 8 times more likely to die if they are unvaccinated as compared to being vaccinated. And that's in Omicron in Chicago.
You say quite a lot, hundreds a week, that's 700 a week. Thousands are going to die from this?
No. So 100, so 20 a day, what is